Hi, Sue. Welcome to our platform. I'm very excited to be interviewing you today. Great. So, Sue, would you tell us a little bit about yourself and some of your achievements within the industry?
Well, I'm an equine veterinarian, what I've done all my professional life. So I graduated in 1980 and then spent 2 years in the United States, first of all at the University of Pennsylvania and then in private equine practice. And then I came back to the United Kingdom and I've been working at the Animal Health Trust for 37 years until very recently. And I've recently left the Animal Health Trust and I'm working independently.
Wow. Okay. So I'm assuming that most of your research has been done through the Animal Health Trust. Is that right?
Yes, not always alone, sometimes in collaboration with other individuals or groups as well. But my job has been very much a role as both a clinician and clinically related research. So all the time I'm being involved with clinical investigation of lame horses and horses with poor performance.
That is very, very interesting. So when I looked you up on ResearchGate, I don't know if you're aware of this, but you have 362 researched items, 4,673 reads, and 6,992 citations. How insane is that?
I had no idea at all. I don't follow these things very well.
That's amazing. So you've contributed so much to our field in terms of research. I just think that's incredible. I've recently started spending quite a lot of time reading research papers and reviewing them for our online pet health members, and it's been absolutely one of my favorite jobs as our content coordinator. And I came across your paper on can the presence of musculoskeletal pain be determined from the facial expression of ridden horses, and it's fascinating. Reaching out to you, you pointed me towards some more lameness papers that you've done, and it's just incredible. So from your main areas of research definitely seem to be lameness, saddle read, which is fantastic, and then conformation. What else fascinates you in terms of research?
Any aspect of lameness and performance. And the reason we got into looking more at the behavioural aspects of things was because I was very concerned that many owners were rather poor at recognising lameness, and it was clear lameness is not something which is very easy to teach to lay people. And I was sure that horses were trying to communicate to us by their facial expressions and behaviour that they were feeling uncomfortable. And historically, I think that has been ignored, and horses have just been called rumpy horses or difficult horses or unwilling horses. So I felt sure that if we did this research, we could demonstrate with scientific methodology that horses change in their facial expression if they're uncomfortable. So it was a means to an end, because I wanted people to recognize earlier on that their horses had a problem, because it is easier to treat a problem the earlier that you identify it. And I also see a lot of veterinarians who are good basic veterinarians, but they don't understand enough about ridden horses. And the client goes to them saying, my horse doesn't feel right. They trot it up and down in straight lines, they watch it in circles on the lunge, and they say, I can't see any lameness. It can't be lame. It must be behavioural. And I think that's absolutely nonsense. So I felt compelled to try to better educate both the horse-owning public and the veterinary profession about a different way of looking at horses and understanding them more. I very much come from this as having been a horse rider myself. I rode to a high level nationally, and I think that I have learned such a lot from feeling horses as well as observing horses. And those are the things that drive me to try to find out more all the time. It's very easy to just look at horses on a daily basis But my goal has always been to learn from those horses and therefore to progress our diagnostic and treatment methodologies.
That's fantastic. I mean, they say that you can listen to a horse when he whispers to you, or you can listen to him when he's screaming and shouting. So I think this is just one more way that we can make it easier for people to listen to those whispers, right?
Yes, so people have to learn how to do this. It's not but once you start to look properly and think about what you're seeing, then I think you will appreciate that these things are quite easy to observe.
Very much. And for some of us, it's you know, as I read through the behaviors that you described, that you're looking at in the ecograms, I think for some of us, we are already looking for those things. We're already recognizing and seeing them. But to put it down into, you know, into an ethogram or a composite lameness scale score, or pain score, should I rather say, it makes it much more quantifiable, much more objective, and much less of, I think that's what I'm seeing, and I think that's what is happening here. And we've seen through research that our lameness scores are not as, you know, they're not as great as we want them to be. There's a lot lacking, especially in the lower grades of lameness. You know, grade 1 or 2 lameness, there's very little reliability between observers, and even in the same observer, we're not sure about what we're seeing. There aren't enough descriptors for us to be looking at the lower levels of lameness. So I really like this is starting to fill in that gap for us a little bit and give us some more to be looking at.
Yeah, I feel that it's very, very important that we train our eyes to look and to see, and that also we just don't rely on seeing horses in hand and on the lunge, but we have to see them ridden, because we learn so much from looking at the entire horse ridden, because the entire horse modifies its way of going in the face of lameness. And I think people don't appreciate that, and they assume that if the horse appears sound in hand and on the lunge, that it will necessarily be sound when it's ridden, which is absolutely not the case. And we also remember that there are many horses with poor performance who, for example, can't push properly from behind, who have a symmetrical hind limb gait. So you can't grade the lameness because both hind limbs are affected very similarly. Now, it may be if you put the horse on a 10-meter diameter circle to the left and to the right, you can then induce it to take some lame steps when it's ridden. But if you just see it going around the periphery of the arena, unless you appreciate that the horse is not pushing properly from behind, not moving through its back as it should do, you will miss the fact that, in fact, this horse does have compromising gait.
That's very valid and valuable. I don't think that we include ridden evaluation into our assessments often enough, just on a day-to-day basis. So can you tell us a little bit more about what behaviors are you looking at for this ridden ethogram? What do you look at?
So first of all, to describe an ethogram is a series of behaviors with strict definitions. So we are looking, for example, at the position of the horse's head. Is the horse's head static, or does it move up and down, or does it move from side to side? Movement up and down or side to side are abnormal. What is the posture of the horse's head? Is the front of the horse's head in a vertical position, which is correct, or is the horse above the bit? And for the purposes of the ethogram, the front of the horse's head must be more than 30 degrees in front of the vertical for at least 10 seconds to be classified as abnormal. We are looking at the position of the ears, whether the ears are forwards, erect, or backwards. This is a timed event, so the ears have to be back for at least 5 seconds to be called an abnormal behavior. So just track movement of the ears backwards and forwards as a leg aid is applied would not be abnormal, whereas persistent pinning back of the ears would be abnormal. So we look also at the movement of the horse's tail, A normal horse's tail will oscillate from side to side in rhythm with the horse's movement. If the tail is consistently held over to one side, that is not normal. If the horse occasionally switches the tail, that may be just through the response to a leg aid or to an insect landing on the horse. But if the horse is constantly swinging its tail vigorously, that is not normal, and that is an abnormal behavior. We look at the willingness of the horse. If the horse has to be kicked repeatedly or it stops spontaneously, those are regarded as abnormal behaviors. We look at the speed of the rhythm. A normal horse trots with about 35 steps per 15 seconds. Some horses become very tense and they rush. So if there are 40 steps or more every 15 seconds, that is regarded as a rushed gait. Whereas if there are less than 35 steps in trot per 15 seconds, that is regarded as a slow gait. We also look at the way in which the forelimbs follow the hind limbs or don't. So in a normal horse, the left hind limb follows the left forelimb and the right hind limb follows the right forelimb. If the horse moves crookedly, so for example, the left hind limb is placed going on the left rein on a track such that it is inside the imprint of the left forelimb, then that is regarded as abnormal. So we have 24 of these behaviors, and we have demonstrated by comparison between non-lame horses and lame horses, and looking at lame horses after we have removed their pain using nerve blocks. We have demonstrated that the exhibition of 8 or more of these 24 behaviors is highly likely to reflect musculoskeletal pain. Now, there are some lame horses who are stoical or only have a very low-grade lameness who will score less than 8, but no normal horse scores 8 or more. In fact, the average score for a non-lame horse is only 2 out of 24. So that's a big difference, 2 versus 8.
So what you're saying is that in a horse in pain that is not lame, they will show a maximum of 2 of these behaviors.
It's an average of 2.
An average, okay.
Yes. So when we looked, it ranges from 0 to 6, but the average is only 2.
There's only 2.
And the most thing will be the head very slightly behind the vertical position or mouth opening.
So what I'm finding interesting that is obviously one of the arguments for not, for the reliability of this scoring system is that the level of training of the horse could impact these things, and especially in a younger horse, resistance behaviors, or how do you you have another word for it, but basically resistance to the aid or to the training. What those results are showing is that basically a horse that is not in pain is not likely to show any of these behaviors, regardless of the level of training. Is that right?
More or less, yes. Now, a young horse learning a new movement may find it a bit difficult. They may be a bit confused. They may, for several days, show abnormalities of behavior. But if that was to persist over weeks, then that is likely to reflect that there is an abnormality. When we compared the normal horses and the lame horses, we had a very broad cross-section of types of horse and different work disciplines. So some of them were just general purpose riding horses, whereas others were higher level competition horses. So we have applied this across the board so that we feel that it is pretty reliable. Now, obviously, there are potential confounding factors like the standard of the rider, the fitting of the tack. So everything has to be taken into consideration, but assuming that the tack fits, then can be reasonably confident that if there are 8 or more behaviors, that it will be a reflection of musculoskeletal pain. Mm-hmm. Now, you could have a rider who isn't very good, and the horse, for example, is above the bit and it's swishing its tail and it's got its mouth open and its ears back, and may show, say, 10 behaviors. and I put a better rider on the horse will still, if it's got underlying pain, show 8 or more markers. Those markers may change. With the better rider, the horse may suddenly go behind the bit. It may suddenly start to put its tongue out. It may start to swish its tail more than it had done previously. So the behaviours may change, but the horse will still show at least 8 signs indicative of underlying musculoskeletal pain.
That's fantastic, because I've often heard that a good rider can mask a lameness or a subtle lameness. So basically the signs will just change. Some of them are easier for the horse to perform, like going above the and so if the rider's not very good, then that's what he will do. And if the rider can block those behaviors, he'll just show it in a different way. That's amazing.
Absolutely, yes, yes. It's very exciting, I think.
It's very exciting. It's amazing. This has definitely got massive from a welfare point of view. How easy is it to teach people to apply this ethogram? So how practical is it for us to try and teach our trainers and owners and riders to apply this themselves?
Well, we've only put it to the test with a group of veterinarians who underwent some preliminary training via a PowerPoint presentation with audio recording with it. And they were not very good to begin with. But then having checked with the PowerPoint presentation, and then they had some test animals, and then they were provided with feedback about their performance. When they then came to evaluate live horses, they scored very consistently compared with an expert. So we think that with appropriate training, people can do it. Obviously, there's going to be individual variation in people's ability to concentrate and focus, because there are lots of things to look at. So there are going to be people who some people find it easier than others. But even without training, we also put to the test a group of people of various backgrounds. There were a small number of vets, some equine technicians, and an equine nurse. And even without training, they could differentiate between lame horses and non-lame horses based purely on behaviour. Their scores were not absolutely the same as the expert, but they could still make a differentiation. And these were horses with low-grade lameness, so they were only focusing on the behaviour. And to facilitate training, I am in conjunction with a group called Equitopia in the United States, producing a training video, which we hope will be seen around the world by people so that they can develop these skills.
That's fantastic. So with essentially a minimal amount of training and some feedback, you could reliably use this. You could reliably use this to assess for pain. And if I think about, sorry, carry on.
You've got to train yourself to look and see. Now, we put it to the test with veterinarians who've already been trained to a certain extent to observe. An individual who hasn't been used to really looking and seeing, it may take them longer. But if they apply themselves, I'm quite sure that the skills are readily acquired.
That's fantastic. If I think about a good trainer, they're looking. They're looking at all those behaviors already, probably from a different perspective. They're not identifying it as pain, but they are seeing them. So I think it would be quite easy to transfer that, just that shift in thinking to a good trainer, for example.
Having encountered some trainers who've discussed this with me, because they say, well, if I tell my client that this horse may have an underlying pain-related problem and that they should seek advice, then I lose the client for the time being and I lose my income. So there is some commercial resistance which needs to be overcome.
That is certainly a challenge. I have to say, for at some of the competitive yards where I've worked, the trainers have been very good to say a horse looking a little bit resistant or uneven, or, you know, not quite happy. And they've immediately given that horse to me for the week. And because it's a low level, it doesn't necessarily take them out of work. But I'm not doing a full diagnostic workup. I'm just treating what I feel and what I see. So I think there are ways where you could work together with competitive yards where there's one trainer almost in charge of the welfare of the horses that's managing and training them. But yeah, if diagnostics and massive is necessary, then I can understand that loss of income for them over time might be a current.
Yes, we have to have a compromise.
Always has to be a problem. So my next question is the amount, so is their score a reflection of the amount of pain that they're in, or is it just, you know, there is something wrong? So if they score above 8, then there is pain, or if they score 12 or 15, does that mean they're in more pain than if they scored 8, for example?
No, I think horses are individuals just as people are individuals, so they have different levels of pain tolerance. I think it may reflect in part the chronicity of the problem. My impression is that some horses who've been in pain for a long time tend to show more signs, but I don't necessarily think it reflects the degree of discomfort. If you were to grade the lameness and say, is the lameness grade in any way related to the pain, to the behaviour score, you would say, no, it's not. The easy answer is no, there is no correlation between the actual behaviour score and the degree of discomfort, as far as we can tell, because some horses adapt so well to moving with low-grade pain. So they stiffen their backs, they take shorter steps in order to minimize their pain. So you probably don't get, just looking at the horse, a true reflection of how much discomfort it's in. Now, maybe if you start to use nerve block techniques to take away pain from one limb, you may suddenly realize it's much, much lamer on the opposite limb now, which is a reflection of the degree of pain that the horse overall has. It's not a straightforward situation, though.
That's okay. I think that even if it is not a reflection of the degree of pain that the horse is in, it brings us one step to improving our evaluation abilities and to be more objective and quantifiable as we go. And the fact that the pain score or the score changes after the abolition of lameness with nerve blocks shows us that we can use this as a way of monitoring the efficacy of treatments, which I think is fantastic.
Yeah, absolutely. I think that that's a very good way of monitoring the response to treatment. Sometimes when we are evaluating horses, we use it in exactly that way. Well, the horse has improved a lot from it's improved in terms of its behavior score, but it's still not normal. So what are we missing? Have we missed some of the diagnosis? Or is it the saddle that's causing the problem? Or is it the bridle that's causing the problem? It encourages us to look further, try and resolve all the problems.
Sue, I think that might be all the questions that I can think of. So thank you so much for your time. I really appreciate it. And I very much hope that I will be having some more conversations with you in the future.
Okay, you're very welcome.